Hi, everyone. Thank you for joining us for the first Ambassador Circle virtual event. We were unable to be together in April for executive briefing, so we decided to bring Carter Center program information to you. My name is Ursula Hamilton, Associate Director of Ambassador Circle. I would like to introduce you to the rest of the team. Ann Venable, Senior Associate Director of Ambassador Circle.
Good afternoon and welcome.
And we'll be monitoring the Q&A room, so please click on the Q&A link at the bottom and submit your questions there. Jared Mooney, Associate Director of Ambassador Circle.
Hi everyone, welcome.
Jared will be hanging out in the chat room, sharing links and information. Alden Mahler-Levine, Program Assistant for Ambassador Circle.
Hey everybody.
Please remember, if you have any questions, submit them in the Q&A room, and you can find our helpful resources in the chat room. Thanks, Ann, Jared, and Alden. I'll see you folks later. Our presentation today will be on the Rosalynn Carter Mental Health Journalism Fellowship and its impact on COVID-19 reporting. Joining us today are Carter Center Senior Associate Director Kari Cobham and Carter Center Mental Health Fellow Yanick Rice-Lamb. Kari has nearly 20 years of experience in journalism, digital storytelling, and newsroom leadership. Prior to starting at the Carter Center, Kari was with Cox Media Group as the Senior Manager of Digital Content, where she led content strategy, news partnerships, and training for newsrooms across the United States. Yanick is an independent health journalist, author, and educator. She is also co-founder of the health website fierceforblackwomen.com and an environmental health fellow through the Fund for Investigative Journalism. She loves sharing her expertise with students as a professor in Department of Media, Journalism, and Film at Howard University, where she's pursuing a doctorate in medical sociology. Previously, she worked at BET Weekend, Heart and Soul, a health fitness magazine, the New York Times, the Atlanta Journal-Constitution, Child Magazine, and Essence. Her topic for the Carter Center Fellowship this year is the hidden scars, the impact of COVID-19 on the mental health of African Americans. Hello, ladies, and welcome.
Hello,
Hi,
thanks for
Ursula.
having us.
Thank you for being with us today. Kari, can you share with our guests a little bit more about the Rosalynn Carter Mental Health Fellowship Program?
Sure.
Thank you.
So this is a particularly special time of year for us because we just announced our 2020-2021 class of Rosalynn Carter Fellowships Fellows for Mental Health Journalism. And I know that many of you have been hearing about this work for a long time. But for those of you who don't know, the Journalism Fellowships program was founded by Mrs. Carter in 1996, and we award year-long fellowships to journalists to do a major media project on mental health. So then and now, our goal is to normalize conversations around mental health, to help dismantle stigma through storytelling, and to support journalists to tell these stories accurately and effectively. So the program is now over 20 years old, and we've awarded more than 225 journalists from the United States, from South Africa, Romania, New Zealand, and now we have programs in Latin America, Qatar, and the United Arab Emirates. So each of our partnering countries is working to build a self-sustaining program that will eventually continue without direct involvement from the Carter Center, because that's one of our goals. The projects completed by some of the journalism fellows have directly impacted public policy, and most of our fellows go on to do additional reporting on mental health after the fellowship year has finished. And for a lot of them, the work continues years later. So one of our speakers that you'll hear from today, Yanick, is one of those journalists from this year's class, and we're really proud and excited to have with us today and with our team at the Carter Center virtually. So welcome, Yanick, to the fellowship and to the Carter Center virtually.
Hi, thanks for having me. I'm excited about being part of the project.
Thank you for being with Yes.
We heard Ursula give your official biography, but since we now have you here live and direct, maybe you can tell us a little bit more about yourself and what brought you to the fellowship.
I've always heard about the fellowship, and I was always impressed with the program. It's one of the most prestigious fellowships that journalists can be involved with. And particularly since I have an interest in health and mental health specifically, I thought this was a particularly good time to apply with COVID-19 going on.
Okay. So why did you, can you tell us a little bit about your topic and sort of what attracted you to this topic specifically?
I grew up the daughter and sister of nurses, so I've always been interested in health topics, and it was dinner time conversation and all of that. And I didn't end up going into medicine, but as a journalist, I've always been interested in editing and writing stories about health. And once this pandemic started, it was clear that it was really having an impact on everyone in general, but particularly African Americans, partly because of the health disparities and different inequities across the board, whether it's through education or employment, or access to medical care or even treatment once you're seeking medical care. And I could see the high level of stress and anxiety that people were going through based on, people in my own circle, people I was talking to. And because I teach, I could see it in the faces of my students. I did individual check-ins with them for each class to kind of just have them say what was going on with them or whatever they wanted to discuss. And some of them were very candid about things that were going on in their families, whether they had extra people staying with them in small places, whether they had to leave campus after being on their own and having to return home to the nest and making that adjustment, or whether they were themselves infected, or whether their people in their family had the illness, or whether some of them died, as a matter of fact. And I had one student who, when she came on, she told her classmates, she said, "I really want you to take this seriously because I didn't at first, and my uncle just died and my father is very ill." And then her father did die a couple weeks later. And and you could sometimes see the terror on some of their faces. There was one in Philadelphia, she was going to check on her grandmother at the time, and she looked like she was about to break into tears. So sometimes I had to follow up with them afterwards, or they, checked in with me. We exchanged cell phone numbers and all of that. And then just observing, talking to other people to help keep them positive. And just seeing what was going on everywhere, I knew that it was having a big impact. And then starting to look at the numbers, it was talking about the high rate of stress and anxiety amongst first responders, among essential workers, and a lot of African Americans are working in the health professions, and also they're essential workers, which means that they can't shelter in place. And also some of them are using public transportation, so they're at risk, they're seeing what's going on directly, and it's having an impact on their lives. So I thought it was really important to do that. And I came up with the idea of Hidden Scars right now as a 4-part series. We could see if that changes as time goes on. But I was particularly interested in also looking at the elderly and looking at students in addition to just adults in general. And also looking at resilience too, looking at what people are doing to cope, what's been working, and how people have banded together, because there have been some good stories that have come out of this as well.
Yeah.
Can you share with us possibly some of the resources that you might share with your students when to seek help? What things are you telling them to do during times like this?
I direct them to contact the Office of Student Services or a counseling center. And I've also reached out on my own to them. And I had an unusual situation in one class. I teach one of my classes, the media entrepreneurship class. And during the presentation, one of my students mentioned something about having been suicidal. And so the dean, she happened to be on one of the judges too. So we immediately, spoke to him then, and then follow up with him to make sure that he was okay. And I reach out to some of them. I'm still in contact with a number of the students, but so we're seeing a lot of things in real time and hearing stories about their parents and their grandparents who lost jobs, who went to the hospital, who couldn't get help, how many times people tried to get, tested and things like that. So, and hearing these stories around the country and also around the world. So it just kind of drove it home for me. And then also knowing that African Americans don't always have access to mental health. and there's always been a stigma attached to it as well. And although more people are seeking help, there still aren't enough people who do that. And this is really an important time to do that, not just for African Americans, but people in general, because stress is up overall for everybody, because this is a great unknown that people around the world are dealing with. But when you have underlying health factors and when you have inequities, it just makes it more of a burden. And one psychologist described it as another Hurricane Katrina.
Mm.
So you're connected to the Howard University community and others, and a lot of what you said sounds really layered in terms of the issues connected to COVID and the Black community. What are some that you have seen sort of rising to the top as you interact with your students and with your family members and with your friends?
I think that particularly in the beginning and still continuing now, there's this fear of the unknown because this is new for everyone. And then there was so much confusion in the beginning to wear a mask, to not wear a mask. It affects African Americans. It doesn't affect African Americans. You have, mayors, governors, and the president doing different things at different times. So there are all these mixed messages coming at people, and still are to a certain degree too. You're opening, you're shutting back down. Some cities and states are having higher rates than they had before. So there's still a lot of confusion, I think, and that kind of contributes to the fear. And then when, because of implicit bias, when people are not getting the treatment that they expect when they go to a hospital or to a clinic or a physician or something like that, if they feel like they're not being treated as the same way as everyone else when it comes to testing, or who gets this type of treatment, who gets sent home, who gets to stay, all those, and how many times you have to keep going back and forth, that also raises a lot of anxiety among people. So that whole trust factor is a major issue. And I think that, unfortunately, that'll have an impact even when the vaccine is ready, because some people are concerned about, who's going to have access to it. And some people are concerned about whether they'll be guinea pigs. So, that's not going to be helpful when you try to get people to kind of comply with different things. And then you have people doing all sorts of different things. I think
there's some history there too, right?
Yes.
Yeah, there's some history there too with the Tuskegee syphilis experiments of the past. So even if people weren't around for that, they were around when apologies were issued, or they just keep hearing about it, because that's affected clinical trials. Although more African Americans are participating in clinical trials, some people are still hesitant because of that, or because of plutonium experiments and things like that. So some people don't want to go first when the vaccine comes out. They want to take a wait and see approach to see if this is really working. And the same is true when things started reopening, when people started saying churches can reopen, and people say, well, I'm not reopening my church, or I'm not going to my church, and people are doing some of the same things about schools. So there's a trust issue that I think that needs to be worked on and needs to be addressed. And people need, good information. So one of the things I'm hoping is that I can help provide, good information and resources for people who need help, as well as to make this information available for people who impact policies too. Because I think throughout the whole spectrum, whether you're receiving the services or whether you're providing services or whether you're coming up with the services, that the way those things are addressed and the way information is shared is very important.
So let me ask you this. We have a question from someone that's a guest of ours. They want to know, how do you think we can build the trust in the African American with the systems being broken? What do you think is the first step?
Part of it is I think more unity in terms of providing the information and without contradicting people, because I think that's what a lot of people see. They see mixed messages. And then I think also in terms of even like with the contact tracing. So some people have talked about having more people involved in their community, so that when someone is reaching out to someone, there's a trust there, because they know this person is not trying to steal their information, or they have questions about how it's going to be used. So if they see other people in their circles being involved in it, and people sharing their stories too. I've seen some people sharing stories about, about recovery, because a lot of people are recovering. but sometimes people only hear the negative stories too. And that's one reason I said I wanted to write about resilience as well, because a lot of people have come together to help each other, whether it's with, educating children who are being homeschooled, or providing food to people, or sharing masks, or a lot of different things. So I think that's important to tell those stories. And then also I think in the medical profession, for people to be conscious of how they're serving the public too. People have done tremendous work in that area, but there have been some cracks there too that have affected people. So I think that just some consciousness of that, of how it's coming across, and how people are, feel left off, because those stories get played too. I know someone who lost someone, and they said, he went there 4 times and he ended up dying. And maybe if they had, taken it more seriously the first time, he'd still be here. So, when people keep hearing things like that, that's not helpful. But, but sharing the stories of people who have bounced back, or they did go get treatment, or, they're surviving. So, and looking at the cup half full and not half empty, I think that's really important too.
So we're seeing that the Black communities and people of color are being disproportionately affected by COVID. And you mentioned that your stories are going to address issues and resilience for students and seniors, and to really get that information out there. What are you hoping will be the impact of your project, of your fellowship project?
Well, I hope that it has immediate effects in terms of helping, individuals, and also helping people serve them. But I also hope that, stories that I do and stories that other people do also help people with anything that happens in the future. Hopefully we don't have to go through this again, but, but it's not the first time in history that has happened, or that something maybe on a much smaller scale has happened. But there's lessons to be learned. It's 2020, and there's a lot of things that you would think would operate better at this point, or that we wouldn't have to deal with to this extent. So I think there's still lessons to be learned. So some of that I hope to uncover the extent of those lessons in my reporting, and also working with some of the mental health experts and resources through the Carter Center.
All right.
So I have another question, if you don't mind, ladies, and you can decide who would like to take it. I have many white people are still learning about levels of discrimination, which are experienced every day by people of color. What information are you sharing about the reasons people of color are impacted by the virus at such high levels?
That's one of the things that I want to look into, and that's one of the reasons I was really interested in doing this, because there are a lot of layers that people don't think about. So if you, a lot of times people are, last hired, first fired. So there are high unemployment rates among people. If a lot of people working in the service industries and restaurants aren't open, or different places aren't open, that means that you're not working. Or if you're working a second job, the second job may disappear. Or if you can't shelter in place, that means you're being exposed, and then you're stressed out about bringing that back to your family, or if you're caring for an older adult in your family. So some people are stretched in both directions, because they're taking care of children, and they're taking care of older people in their family, and they're wondering they need help with the caregiving. So or if you have we have African Americans that we're setting records in the wrong direction, unfortunately, but we have higher rates for a lot of different health conditions. So, and even with something like breast cancer, although we don't get breast cancer more often, we die from it more often. Yes. So when you have underlying health conditions, and there's something that's going on that can make, that places you at greater risk, that's another area of stress. And then at the same time, there have been some people who've been dismissive, because then all of a sudden, that's just affecting more people of color, I don't have to worry about it. So then that adds a layer of stigma to whether you have COVID-19 or not. So there's all these different things piled on top of another. Or, in some cases, you have people who don't have all the equipment they need at home to learn at home. They may not have the Wi-Fi connections they need, or the computers they need, or things like that to work from home or to teach from home. And the schools are different. Even if they're good schools, sometimes a lot of it's falling on parents who are also working at the same time while whether they're at home or whether they're not at home, and then trying to make sure their children get a good education. And if their children, if they're depending on like the free breakfast or free lunch or something like that, if they have lower incomes, then you take that away. Then it's, how do I feed my children? How do I take care of them and go to work? How do I get to work? Because I have to get on the bus or get on the subway. And, you know, that places me at greater risk just getting to and from work. So there's a lot of different levels to this, you know, all across the board that, you know, an average person may not think about and stuff too, or just even trying to, you know, people are spending more money because, you know, things are scarce. So sometimes in the beginning you had to kind of buy whatever you could buy, whatever was there. So you may be spending more money on food. And if you have to have someone extra staying with you, that's an extra mouth to feed. Plus people are home all day. So, you know, people want snacks and they want whatever. So you may be saving money over here, but you're spending money over there. So there's a lot of hidden costs too that, you know, just for people, there's a lot of people who are behind on rent or on their mortgage. So there's that pile up when they have to catch up, or they're, or even if some cities have said, put a moratorium on evictions, there are people still trying to evict them, you know? So I've sat in on a city council meeting here in Washington, and we heard about that, you know, actually happening, even though it's not supposed to happen, but people are still trying to do that, and they have to go after them to make sure that those things don't happen.
Yeah, and I do want to add, I mean, like in my own community at our neighborhood school, we have students who get, you know, their free breakfast or their lunch is the only meal of the day. And so there's been a lot of like the community having to come together to fill the gaps because nobody else is going to fill them, right? Because people are filing for unemployment, but it's taken 2 months, or parents are being infected with COVID, and you know their children are sort of in a bad situation because of that. And I also want to highlight something you said about access to healthcare and folks not having access to healthcare. And then if you do go seek healthcare, then there are challenges with how you're believed and treated in the hospital just simply because you're Black. And so that has also been a challenge for COVID. You mentioned somebody went 4 times and then they died. I mean, that's not the first story that I've heard about something like that. And you can imagine how much lower the numbers would be if that sort of bias didn't exist in the, I mean, across the board, but especially in healthcare as well.
Yeah. And another thing too, and not just among African Americans, another communities, a number of communities this is also true for, is that all the rituals associated with end of life too. So people wanting to be there with their loved ones when they're ill and when they're dying. And then also having the funeral or celebration of life or homegoing. People call it different things, but that's really important. And not being able to attend or not be able to plan it the way you want to plan it, because those things are for us to live in. And that's another level of stress a lot of people are going through as well, is not being able to see their loved ones before they die, or when they're ill and they want to be there for them. Yeah, at a hospital or a nursing home, or maybe because they were in a nursing home and something happened and they felt like they placed them at risk because they weren't taking care of them at home. Exactly. And African Americans traditionally have not used nursing homes to the same extent, but that's changed over the years too. So there's a lot of guilt there as well, and just, you know, sadness, I think. And also because some of the underlying conditions, some people are dying probably sooner than they would normally. So I remember seeing a picture of someone, and she had there's 3 caskets lined out in front of her. You know, I think it was in Detroit or something like that. And I couldn't imagine like having 3 people in my family dead at the same time and looking at 3 caskets like that, you know, and particularly when it's all of a sudden. It's not, you know, even if it was a car accident, but still, you know, it's like you don't expect something like that to happen. It's not an everyday occurrence. So, you know, people who were otherwise healthy or probably could live, you know, another 10 years, 15, 20 or whatever, or 5, and they're suddenly gone.
Yeah.
Yeah.
So I have another question from Andrea France. Covering people's stories of illness, death, job loss, evictions, and abuses when they are out there protesting and emotionally taxing for journalists. While it's not exactly like the trauma of war covers, the effects on their own mental health can be very real. What would you recommend journalists do to guard their own mental health as they do their jobs?
That's something that's been getting a lot more attention too. There's a DART center at Columbia University that researches that and provides resources for journalists, but I'm also a member of the National Association of Black Journalists, and they've been having a number of sessions for, as have other journalism organizations, to kind of remind everyone to protect themselves. You know, we're talking about if you're covering a protest, or if you're covering COVID-19, because you're hearing about death and illness over and over again. And even with my students, I was, you know, sometimes trying to do things with them that were different and had nothing to do with COVID-19, or, you know, and just also reminding them, I'm not expecting you to go outside, you know, that you're going to have to report in places like everybody's doing, because everybody's in that same boat where they're figuring out how to do that now. And it can be hard. I remember I was working on a project on dementia, and my mother had dementia. And right as I was wrapping up the story, my mother died. So they gave me a little more time to work on it, because I needed to work through that myself. And then the person that I was making the main person of the main focus of the story, then his mother died. And he actually, I talked to him while he was sitting next to his mother, who had just passed. So it was a very moving story, but it was a very emotional, you know, story to tell, just because of the circumstances of it towards the end, with my loss and then with his loss and that kind of thing. So sometimes, you know, that you have to kind of balance it, and because we hear so much as journalists, you hear exactly how many victims they were, and about limbs missing and fires and different things like that. You hear all the inside details that don't necessarily always make it onto the news. So you have to find ways to kind of balance that in your life, and make sure that you are doing things that kind of, you know, relieve your own stress, or that make you happy, so that you can come out to share that information, and that you're kind of practicing what you preach in terms of self-care.
Yeah, and one of the things we did, I think, right at the beginning of COVID, where, you know, a lot of journalists were, you know, traumatized and stressed out just from the pandemic coverage alone, we started gathering mental health resources that we had vetted that were not just for journalists, but also for the general public, because the Carter Center's mental health program is so well connected in this community, because of all the work and the advocacy and the relationships that Mrs. Carter and our team have built. And so we're able to put those resources together for journalists. And then as the protests began happening, and Black journalists were experiencing additional emotional trauma, so not just losing people in our community, but also having to be out on the streets covering the same kind of generational pain that's been perpetuated for a long time, we partnered with Sarah Glover, who is the former president of the National Association of Black Journalists, and started having these wellness check-in calls for journalists and for allies with clinicians to talk about vicarious trauma. And here are some of the things that you might be thinking and feeling, and symptoms to look out for. And here are some things that you can do to take care of yourself, like unplugging, like leaning on your family, like having a cohort of journalists who understand what you're going through, as a manager, how to look out for your team, and how to step back from it a little bit, because we're living in it, right? This is this moment in time, it's in the air we breathe, and it's what we're experiencing. And so being able to identify what you're going through, and to accept that it's not going to be easy, and putting all these strategies in place to keep you sane, is something that we understood that that's a priority. And you know, Yanick will, when we have our September meeting where all the journalists do the training, we'll be having a session about vicarious trauma, because it's this thing that, even if we're not in this moment of time, even if you're in a newsroom and you're covering fatal accidents, and you're interviewing family members who have been grieving, it still has its impact, even if you don't think that it's that serious, because collectively, those take its toll on you.
Yes, we've referred a number of people to take advantage of those programs that you've had within ABJ. And we had a program at Howard recently called Reporting While Black. And NABJ participated in that as well. And some of the journalists who were on the panel have been covering the protests. And one of the things that's happened now, and it has always happened, is that sometimes the police don't know whether you're a protester or you're a journalist. So then you get arrested, or you may get hit, or you may get tear gassed, and things like that. And so they were also giving advice about even like where to stand to, to cover it. So like if you see them moving, don't move towards the police, make sure you're away from them. So they were giving strategies about things like that as well.
Okay, awesome. Okay, so I have another question. Are the government's COVID relief programs getting to the communities of color? So, and then that's the first part of it. And I've heard that some of the avenues for the financial relief almost automatically exclude people of color because the financial institutions do not already serve the most severely impacted communities. Kari, would you like to speak on that, or Yanick?
I'm going to toss that one to Yanick, and then.
Okay.
I've been hearing, I mean, that's one of the things I would like to look into too. I've been hearing stories about money not getting to where, it needs to be. And there've been, talk about even the next round of stimulus checks, about the debates about whether that's going to even happen or not. And I know ProPublica did a piece, and other people have too, looking at how some of the, how some well-off people or people connected with the administration have taken advantage of some of the payment plans that are to help different businesses. So in some cases, they haven't gone to the people who are in most need or who have fewer resources or connections to getting that. And even with the resources that are available, stimulus checks help, but it doesn't cure everything. That's just a piece of it. And it always does take a lot of time for things to trickle down to people who really need it. Because when people say, save for a rainy day, some people are saving for a rainy day, but they don't have they have trouble saving for a tsunami. And this is kind of what they're experiencing and things like that. So they're stretched to the limit. Or some people live paycheck to paycheck. So any little thing that can disrupt their lives or their budgets is going to place them in a bad place financially, which also impacts their mental health as well. So, and a lot of people are in that boat of all backgrounds.
Exactly.
And you have to think about the relief programs that are currently in place. I know some of them are starting to end in some states, right? So there were eviction protections. Those are now gone. Employment benefits are going to start running out, et cetera. So, there's still a great need for it, but sometimes the resources or the timing in terms of how quickly people can get them, depending on how they need them, that's been an issue as well.
So yeah, very, very true. So Mary Long is proposing a question for us. So up until now, the national statistic on mental illness I've heard is 1 in 5 people has some form of mental illness. Do you expect that as a result of COVID-19 that the stat may grow? Thinking feelings of being overwhelmed and despair may impact otherwise healthy people.
Yeah, they're already seeing some of the early numbers. They have already showing that, particularly among first responders and people working health fields. They say that their stress level, at least like 50% of whoever's been polled have been saying that they've had adverse mental health impacts because of this. And looking at previous pandemics or things like that, they've had higher suicide rates as well. And suicide has been increasing in different populations that it hasn't been increasing before. So that's another concern that's out there as well.
And we also have to think about the fact that for folks who have existing mental health challenges, it's tough, right? But there are others who may not consider themselves to have a mental illness, but now you're dealing with things like isolation at home, loss of family members without the usual outlets to deal with it, and that is impacting people who may not be living with a mental health disorder. I remember reading that they're calling mental health the fourth wave of the pandemic. So we expect that things are going to get worse. From what we've seen, like the mental health program, we do a lot of work in Liberia, and Liberia has dealt with Ebola. And one of the things that they saw with Ebola is that that there is a need to address the mental health during and after, because it still has an impact, because people who have had Ebola are still dealing with community stigma. They're still dealing with the after effects of having it, and the mental health impacts, because you lose people or people get sick, it affects your family. And so, you know, COVID is as COVID, we think during and after, we will definitely see an increase in how it's affected everyone's mental health. I think the plus side is here that there is more awareness about mental health, even by people who may not be living with a disorder, because they recognize, okay, anyone can be affected by it in this way. And so we'll probably see more conversations happening around it, people more willing to talk about it and address it. And hopefully we can be in a place on a national level where people will be able to have access to mental health care services, which they're, you know, under parity law, that we're supposed to be able to do that. But that is not happening. So what we're hoping is that as a result of the pandemic and more people being aware, that we'll be able to push more for full parity.
So,
yes.
Oh, go ahead, Yanick. Go ahead.
Oh, I was going to say, I was looking at some of the Ebola numbers related to mental health. And I live in Prince George's County in Maryland, right on the edge of DC. And one of the things that the county has been doing is having a lot of community calls and town halls. And I've sat in on a few of those. And one of the ones they did on mental health, they were kind of letting the public know that it's normal to, you know, to be stressed out or to feel some type of anxiety occasionally related to the pandemic, and that if you hadn't, that may be abnormal, or that, you know, or that you might be in a little denial or something like that. But the point is that they were trying to let people know that we're all in this together. Everybody's feeling something, because this is new to all of us. It's new to everyone. So to normalize it, it's not, you know, it's okay. So it's not okay if you don't do anything about it, but it's not unusual if you are feeling something.
Well, that brings me to, you know, there is pretty much in the African American community, most people do not seek professional help when it comes to mental health. How do we break down that stigma that it is okay to reach out to a professional versus praying about it, or we don't discuss it in our home? I mean, what can we do to make it okay? I mean, the fact that you guys are reporting on it now, but what are other suggestions that you can share?
Yeah, I mean, that's one of the reasons I'm interested in telling those stories, because to sharing other people's stories, because I think the more people hear about it, but I think even on an individual basis, if people share their own story. So I've done that with people. We're saying, well, you know, I saw someone for this or that or the other, and normalize it. Like we go to the dentist for our teeth, and we go to a physician for other physical ailments. And so if we need help with emotional or mental health, we should do the same thing. So I think that people, you know, people don't need to think that they're crazy or that there's a stigma or there's something wrong with them, but that it's just the right thing to do is to take care of it. And that, and I'm glad that some churches are also combining pastoral care with like psychology and psychiatry and things like that, so that people see they need to do both, and you can't just pray it away. You can still pray, but you need to get help if you need help. And I hear, you know, some ministers I've talked to are telling, you know, that to their congregation. I can help you with this and that and this and that, but I can't help you with that over there. You need to go see someone. And some of them have their own counselors who can combine the spirituality part with the, you know, mental health aspect. So I think that's a positive sign. But I think people just need to talk about it. And I've heard sometimes even, you know, women tend to talk about some of their health ailments more than men do. And I've heard like a lot of men saying that about other men in terms of like, say, prostate cancer. Like, I don't know, I wish you had told me that you were going to see someone. And, you know, but I think that's what it takes too, is the one-on-one as well as media, as well as social media, as well as group things, as well as our institutions.
Mhm.
And also families too, right? Like if,
Mhm.
imagine if you're in your early 20s and you're diagnosed with depression and you sort of feel like this is a personal failing, but no one ever told you that your uncle, your aunt, and your granny also had some mental health challenges. Just talking about it within your family and being honest with your family members or your children, particularly your children, I think helps helps on a generational level.
I agree. I think that's one of the things we've written about before, is also like doing your family medical tree
Mhm.
or medical family tree, so that you can talk about the things that run in your family. And like you said, talk about those things honestly. One of the things I've seen since I've been teaching is that I see some students are more receptive about seeking out mental health services, and they don't see it as a stigma, but it still is a barrier in their families. Because I remember I had a student in fall semester, and I was recommending that she go see someone. And I forgot what she was going through at the time, but she didn't want to officially, her parents didn't want her to do it.
Mhm.
And because they didn't want any stigma attached. And I said, there's no stigma attached. I said, we don't need to know why you go or that you go. I said, if we get something says that we need to work with you in this way, we just work with you in this way. Nobody needs to know anything. And there's no stigma attached at all. But her family felt that way. I had another student who was suffering from bipolar syndrome, and some people in her family didn't believe that she was going through that. They said she was making it up or she was faking it. So, so sometimes people outside of, aren't supportive, or when they come and they're outside of the home, then they were like, well, my parents not here to make me, I'm not taking that medicine anymore, or I'm not going to they're non-compliant. They're not seeing who they need to see, and they're not taking medication. So, sometimes I have, conversations as much as I can have, because I'm not a mental health expert, although I've gone through some of the, trainings or workshops, whatever we have available. I've done those things, but so that I can, get them to go see who I offer to walk with you if you need me to, or if I'm not the person you want to talk to, we can find the person you're more comfortable with, but take advantage of all these resources that we have that are out there. So trying to help them, find that. And sometimes students themselves are supportive of each other too. So I think that peer-to-peer and within your family, or, all that stuff is very important.
So as we are heading back to school in the next couple of weeks, some kids are going virtual, some kids are going back face-to-face, splitting time. Do you think at this point that we really need to ramp up some type of mental health program in the schools for kids to deal with this? A lot of our children have not seen their peers or seen their teachers in person since March. And now we're going to go another 9 weeks of isolation again for them, and having to, learn virtually. What do you think, either as parents or for the schools, that we could do to continue to help our children during this time, especially young children? I have an 8-year-old son, and I've had to explain to him, in the very beginning, of why he can't have play dates. He understands it, I believe, to about 95% of it, but at the same time, he still does not fully get why the pandemic is still here, why is it affecting us like this, because he just wants to play. What are some suggestions that you guys can just give, our guests, of things that they can do to handle this?
Well, I think being as vigilant as possible. I have my 8-year-old grandson is here with me now, is downstairs, but and that's kind of what we've had to do too. One of the things that's been helpful for him is that he's been playing with some of his friends electronically.
Okay.
Where they're using tablets and phones, so they're talking to each other while they're playing. And he does that probably almost every day. We have to kind of monitor the time period. And then we do things as a family more too. So whether he goes to play basketball with his son, or we're playing tennis together. So we're trying to have more activities, or going out in the yard and having a water fight or something like that. But we're just trying to do more things to keep him engaged, and trying to keep an eye on him, or, what he's talking about, or what he thinks about different things, because it's a brand new world. He's adjusting pretty well, but I think it is unusual because normally he'd be able to play with more kids. There's like one that he's been able to play with, but other than that,
Yeah.
he hasn't been able to see some of his old friends that he would normally see. And I
Yeah.
think it is, and they do want to be at school,
Mm-hmm.
and not just on Zoom, but
Exactly.
but it's a safety issue. So I think that, I think communicating with them as much as possible and making sure that we get help for them if they need it, or if it looks like they need it, and then make sure we get it ourselves.
Yeah.
I do want to add that,
Yeah.
I have a 7-year-old too, and I'm not a mental health professional. I'm a journalist by trade, but every day we talk about on a scale of 1 to 10, how are you feeling today? With 10 being with 10 being great and 1 being the absolute worst. And then based on how she's feeling, then we'll figure out what the plan for the day is. And sometimes she just wants to be on the pad or play virtual games with friends, but sometimes they need their cup filled, right?
Mm-hmm.
And so we do that. On a professional level, the mental health program is heavily involved in Georgia in school-based behavioral health. And so the goal is to make sure that that mental health services for children are as accessible as school lunches in Georgia schools.
Mm-hmm.
And so I would encourage you to look at that initiative, but also communicate with your school district or your school principals about what are the mental health services that are currently available to your children, and push for more if there aren't that many left, and definitely look into the school-based behavioral health initiatives that we have going statewide, because I think that they'll be more important now as we come out of COVID and children are trying to readjust to whatever school looks like and whatever those relationships look like.
Mm-hmm. So, Kari, so I want to take it back to the fellowship program. Can you, what is ongoing technical guidance assistance? How does that look like for journalists in the fellowship program?
Do you mean in terms of how they report?
Yeah, how they report exactly. If you can give a little more in depth on the program for some people. So we're having a question of, how have journalists been impacted by this program? If you could just tell us a little bit more about the fellowship program. I know you gave us an overview, but
Right.
yeah. And how many people you have in the, in the class, and if you want to highlight, upcoming things.
Sure.
Yeah.
So every year, one of our main programs for the year, or main activities, is that we train our incoming class on how to report effectively on mental health. And so we bring in our fellows from the US, from Latin America, and from the Middle East. Ideally, right, in a perfect world, in the before, they used to come to the Carter Center. Now we're doing it virtually. But part of that is to set them up for the fellowship year so that they know how to accurately and effectively report on mental health. And some of that is, what kind of language do you use so that you're not further stigmatizing people who live with mental health disorders, or saying that people live with a mental health disorder versus suffering from, which is something that even I say sometimes, because it's just so much part of the vernacular, right? So how do you report in a way that doesn't cause harm without even realizing it? And then what are the things that will help them through their projects? So for example, approaching projects from a solutions journalism perspective, which is not just listing out, okay, here are the problems and here's somebody's story, but also here's what recovery looks like and here are some solutions that we can approach. As we talked about earlier, the journalists also go through a session on vicarious trauma and really understanding, like, when you interview and talk to people who are grieving or who are dealing with family members who live with mental health disorders, then that can be a tough situation. Last year we had a fellow who had been following a family out in Seattle, and their son, who she had interviewed, died by suicide. And so she ended up sitting with the parents as they cleaned out their son's apartment. And that's a difficult thing for the parents, of course, because nothing can match that level of grief, but also for the journalist who's sitting with you. And so these are the kind of things and the conversations that we try to prepare them to have. And then what we've seen, and I mentioned this earlier, is that some of the work that our fellows do, I think 1 in 7 of our fellows, their work actually results in policy change. And so, last year we had one of our fellows, Christine Herman, she works for Illinois Public Media, and she did a story on parents having to give up custody to get their children treatment. And that was picked up nationally. And by the end of her fellowship year, there had been changes within the state legislature to try to keep children out of the juvenile court system and address some of the issues where just because you can't afford to seek private mental health treatment should not mean that you have to make your children the ward of the state. And so that's just one example. And so every year we have fellows where that happens, where the governor will allocate funding for people experiencing homelessness, or they will pledge to build a hospital that will serve people who have mental health disorders who are not supposed to be in jail and are still not receiving the treatment that they can. And so what we found is that, a lot of the fellows like Yanick have this incredible passion for reporting on mental health. A lot of them have a personal connection with it, or they have identified an issue as they work on other projects that they want to pursue. And we equip them with the resources and the mentorship throughout the year by a journalism fellowship advisory board. They receive the training. They join a cohort of over 225 journalists who are also reporting on mental health, which is also important to have that sort of peer group to lean on to do gut checks or to say, is this okay? And we support them throughout the year and beyond. So we still have fellows who reach out to us from years ago to say, I'm working on a story on caregiving. Is there someone that you can connect me with? Because Mrs. Carter was involved, has a caregiving institute and that sort of thing. And so we support the fellows throughout the fellowship year and beyond that. And what we see is that their projects just have this incredible impact, not just on a policy level, but also just on a personal level. I mean, as a journalist, sometimes you publish a story, and if you get one note from somebody that says, this changed my view, or this helped my family, or I learned this thing from you, or thank you so much for your story, changing that one life makes a difference, And so that's sort of what our goal for the fellowship is to normalize the conversation, remove the stigma, but also to bring about change.
Awesome. And typically when you're starting a new class in September, the other class is graduating, correct? And presenting their projects. Okay. And is that all going to be virtual as well? You're going to do the graduate?
It is all going to be virtual. And since we have people all over the world, it'll be interesting how we're going to work out. But this year is very exciting because we have a great mix of projects that are directly related to current events. So we have several projects around COVID, but we also have other projects that include if we have a national hotline for mental health. Like what is needed to be in place for that to actually work? Like you wouldn't set up 911 if you didn't have ambulances that could be responsive. So if you're going to set up a mental health hotline, what are the things you need around that? We have somebody else in Colorado that has one of the highest rates of suicide in the country that's looking at how is COVID directly impacting rural communities. So, I think that this year is, I'm really excited about this year. I think we have a great class. I think Yanick is going to be a great part of it. And, it looks a little bit different because of the pandemic, but we'll be meeting virtually. So
yes, and one day face to face.
And one day face to face.
I look forward to that.
Face to face for sure.
I look forward to that at some point.
Yes. So ladies, we have definitely added all your resources. your bios, more information to, learn more about the program in our chat room. Before we get out of here, is there anything else that you would like to add?
I just want to say I look forward to being in the program. I'm honored to be a fellow, and I hope that my work makes a difference. And thank you for accepting me in the program.
Thank you for, yes. We're glad you're here.
I'm glad to be here.
Yeah.
You're stuck
And
with me now.
Yes, I know.
I hope so.
Yeah.
And I just want to say thank you to everyone who joined the call and who's interested in the program and the work that we do. It's because of your support that we're able to continue to support journalists and the incredible work that they put out there. So just thank you from the bottom of my heart, because without you, this wouldn't be possible.
Yes, yes. So thank you so much, ladies. This has been wonderful. On behalf of my entire team, as well as the Carter Center guests, we just again want to thank you. You guys have so much knowledge, and we've learned so much over this last hour. So again, I really do appreciate you joining us today. And of course, Kari, we will be talking soon. So thanks again.
Thanks for having me.
Yes.
Yes.
So I just want to thank everyone for joining us today. If you have any questions or comments, please feel free to email or call us. You can again find that information in our chat room. We would appreciate your feedback on suggestions for future events or just anything about today. Also, be on the lookout for an invitation to our next virtual event, which will be September 1st, featuring the Conflict Resolution Program Syria Mapping Project. Thank you so much for your support. Stay safe and healthy, and we'll see you next time. Bye.
Thank you. Bye.
Bye.